Good morning, my examiner. I am candidate number 003-022-046-26F. I am here for my practical examination.
Okay, take the temperature, pulse, and respiration of this patient.
Thank you, my examiner. Good morning, ma. I am Lovelyn, a community health student. My examiner has asked me to take your temperature, pulse, and respiration. Okay, no. Before we begin, I would like to ask you a few questions. What is your name? Mrs. Joyce Jennifer Ugo. How old are you? I'm 39 years old. Tell me where you live. Number 57 Douglas Road, behind St. Paul's Catholic Church, Owari. What do you do for a living? I am a trader. I sell foodstuffs at Douglas Market. Are you married or single? I am married. Do you have fever, chest pain, cough, or difficulty breathing? Have you exercised, eaten, or tinnitus, or taken any medication before coming? I had fever last night. I am not coughing. I only trekked to this health center and I have not taken any drugs. I will take your temperature. It will help me know if you are having fever. Then the pulse will help me know how your heart is beating. And the respiration assessment will help me know if you are having difficulty in breathing. It is not painful. Okay, thank you. I will allow you to rest a little while I gather my equipment. Do you have any questions? Please let me wash my hands and gather my equipment. I will be back. Your temperature is 37 degrees centigrade, meaning you are not having fever now. Your temperature is okay. Your pulse rate is 71 minutes, meaning it is normal. Your respiration is 25 breaths per minute. It is per minute. It is high. Do you have any question? No, I don't have any questions. Thank you so much.